Hi there, Andrew with Zang Physical Therapy here, and today I want to talk about staying active with an injury. And this thought came to my mind as I was talking with a client yesterday who is about 75 years old, and he's honestly pretty active. You know, he still continues to work in a side business. He was doing painting, yard work, and regularly works out at the gym. And he just so happened to develop a knee issue that has kind of pulled him back from all exercise. And that is just because he's concerned about his movement and everything like that. And what we talked about as we went through things was, you know, is there any reason you couldn't do upper body exercises? He thought for a minute, like, well, no, I can go do those exercises and I'd be just fine with. And then we talked about some of the cardio stuff that he liked to do. And certainly he likes to walk and do the stair stepper. But we found out that we went out to the gym, we found out, hey, I can do some stationary bike and it didn't bother the knee issue. So that's something important to consider. You know, a lot of people, they get an injury, they shut down completely and don't want to do anything because they're nervous it might bother them. When in truth, activity is known to be good for things, and inactivity tends to stiffen up. And as we stiffen up, we get more uncomfortable, which then leads to some pain. And then that cycle continues on and on and on. When if we could take a moment, pause, take a deep breath, and think about things, you know, he now has a good 30 minutes that he can go to the gym and exercise, you know, spending time on a stationary bike, which is going to help that knee stay loose, enhance blood flow, nutrients, and help him progress there. And he can continue his upper body exercises, which he enjoys doing. I believe he was going to the gym regularly about 5 days a week. So, you know, after 2 weeks of going to the gym altogether, we talked about hopefully he's in the gym right now today or by tomorrow, you know, doing something productive. And, you know, this is going to be huge for his mental state and well-being, one, and then two, it's going to help that knee recover better. Just getting it moving and getting it loose, because he was holding it rather stiff. And once he learned and we practiced that if I let the knee relax when I'm walking, it actually didn't feel quite as bad. So it is a normal reaction to tense and tighten up when anything hurts, be it a shoulder, be it a knee in this instance that I'm using. And what we really need to do is stay active, get ourselves moving, and by and large, we're going to feel better much, much faster. So that is the big takeaway here, is to get yourself moving as fast as you can after any injury. Again, I grant you there are certain injuries where you might not be able to move, you break a bone, that might limit you moving that appendage for a while. So I do grant you that. But any other soft tissue injury, find something that you're able to do, even if it's a different mode of exercise. You know, if you're a runner, maybe you have to cycle, maybe you have to swim, but it still is a cardiovascular exercise, which is good for you to release those good chemicals in the body and in the brain, which we seek when we exercise, and kind of stave off some of that anxiety and irritation from not being able to do what we enjoy doing most. So that is the key for today. Stay active with any injury. Again, you don't have to go hard, you don't have to go fast or heavy. Just keep yourself moving. That's going to get you to your goal faster. So I hope this topic was helpful. If you have any questions or comments, please leave them in the chat. I will get back to you. Send me an email, Andrew@ZangPT. Otherwise, I'll talk to you later. Have a nice day.